Well, today's one of those days where, no matter how long you're in government, there are only a handful of days when you get to do something that is truly profound, something that will change lives and save lives, something that will be there and hopefully a lasting legacy, not to a government, not to a political leader, but to a community who said, now is the time. We can put up with failure, we can pay the price of failure no longer. We can do more, we can do better. That's exactly where we find ourselves today. 9 recommendations from the first report, 65 recommendations from this, the final report. On behalf of all Victorians, I want to thank Penny Armitage and her team. I think we chose well. I think we got the best team to go and do this work because they all had their own perspectives, they all knew and understood different parts of this problem, but they then went and opened this process up to literally thousands and thousands of Victorians who had the lived experience of a system that's broken, a system that doesn't work. We've got to make sure that we provide care much earlier and much closer to home. Local early, not hospital late. That is the essence of this piece of work. It's all about keeping people well, it's all about saving lives, it's all about investment. It won't be easy, it won't be quick, it's a long journey. But important work is never easy. That's why we're committed to implementing every one of these recommendations. We'll have more to say about that when the budget rolls around in May, just as last year's budget had very substantial investments. And indeed every year of our term in office we have tried to do more, but now we have a clear blueprint, a clear plan on how we can build not disparate services but a connected system that will absolutely change the lives of those who live with mental illness and those who love them the most, their carers, their families. I do want to just make the point that you can be critical of a system, and we rightly are, because the system is broken. That should never be read down to be critical of anybody working in it. Everybody in that team, and it's a big and diverse team, have struggled with a system that makes it harder. Their employer and the system they work in actually makes the job tougher, as if it wasn't hard enough already. So we thank them, and we thank them for their contribution as part of this process also. So you'll see us make announcements in the budget in May. And then it'll be up to governments for, I think, a very long time to continue investing as we go on this long journey to build a much better system. Some things can be done fairly quickly. We're already rolling out beds, we're already opening up additional services and dealing with the 9 recommendations that were provided in the first report. It will take some time, but I think that this is not a cost. This really is a profound investment in a system that will be there when you need it, and a system that, instead of making being well harder, it'll actually facilitate that. It's a very simple thing, but until you call time on something that's broken, you'll never truly have the momentum and the ideas to get on and fix it. And that's what this Royal Commission process has been all about. To Penny and her team and many people whose names we won't necessarily know, whether it be staff working on all this and those thousands of people with lived experience who've had the courage to come forward and tell their stories, I am deeply, deeply grateful, as I think all Victorians will be. I think we're happy to take any questions you have.
How do you find a new workforce or a bigger workforce? Do you increase pay for workers?
Look, I think that if you talk about any health challenge for long enough, it becomes a workforce issue. Have you got the right people with the right skills in the right place? Pay is part of it, yeah, maybe. But again, it's about a system that people, particularly younger people, as they're making decisions, what will I do with my life? What career path will I follow? We want a system that is the best in the country, that's full of reform and change. That powerful and irresistible momentum I spoke about earlier on will draw people to that system. It'll be the place where you want to work because it is about change and doing things better and all of those things. In my experience, those who work in our health system, regardless of what specialty, regardless of what part of the system, pay is important, of course. They want to be treated fairly, they want to be safe, but they also want to know that there's profound investment so that they'll be able to do more for more people. That's what draws you to those sorts of, to that whole line of work. So I've got great confidence that in partnership, perhaps looking at some different roles, different skill sets, getting to people much earlier, it's much more community-based. I should say that I am very, very positive about a partnership between our government and the federal government. I've talked to the Prime Minister about this many, many times, and there is a genuine commitment to us doing a one out So we do a national partnership between our government and the federal government, and that by the end of this year, and that can become, if you like, a best practice model that all other states and territories could follow. And I'm very grateful to the PM for a genuine and heartfelt commitment to working together. It's that sort of bipartisanship that will see us do so much more for people who need it.